In this second lecture in Unit 6, we're going to focus on analytics with respect to value-based care. There are many uses for analytics in healthcare. Analytics has typically been within the purview of researchers, vendors developing clinical decision support for EHR systems, and registry services offering quality measurement, reporting, and comparison services. Today, it is virtually essential for every provider and health plan to have access to analytics in-house and even at the point of care in order to manage risk and be successful in value-based care. In this lecture, we will look at various uses for analytics in value-based care, compare analytics to informatics, data to big data, and registries to warehouses. The lecture will also describe the data analytics life cycle, consider ways to bring data analytics to the point of care, identify a variety of other uses for analytics, and talk a bit about how artificial intelligence in healthcare has been impacted by big data analytics. Although we're not going to go in depth in either the statistical or technical aspects of analytics, we will cover some of the concepts with which it is important to be familiar. Finally, we will address the major challenges in analytics and big data for healthcare. Analytics has been defined as the systematic use of data, that is, diagnoses, procedures, body mass index, genomic data, charges, supply costs, nurse hours, occupancy, patient satisfaction, and much more, and related business and clinical insights developed through applied analytical disciplines such as statistical, contextual, quantitative, predictive, cognitive, and other models to drive fact-based decision-making for planning, management, measurements, and learning. I've enumerated some examples here because I think it's important in value-based care to recognize that there is no one type of data needed to impact how we can achieve value. It is no longer just cost data or just patient-specific data or financial, administrative versus medical health data. It is indeed the intersection of all of these data and more. I also want to distinguish analytics from analysis. Analysis is a term sometimes used instead of analytics, but generally analysis refers only to the detailed examination of the elements or structure of something, typically as a basis for discussion or interpretation. Further processing on the data examined becomes analytics. So using data to gain insights, which is analytics, is essential in value-based care due to the level of risk implied in its manifestation. Whether risk is not achieving the desired reimbursement or not achieving the level of quality of care, risk must be managed. As such, much better use of the data we continuously generate in both analyzing it and acting upon it can help immensely in mitigating risk. The elements on this slide are good examples, although only examples, as many more examples exist and will continuously emerge. Let's look at these. Continuously identifying potential clinical and operational issues to be addressed is perhaps the most important use of analytics for value-based care. Some examples include identifying healthcare acquired infections, potentially preventable complications, length of stay issues, emergency department overusage, excessive readmissions, and reimbursement penalties. All should be studied in depth and addressed as primary ways to reduce cost. Another example, patients not getting needed post-discharge follow-up, care coordination, timely referral, staff entering paper-based data into electronic systems, workflow not being directed by business rules, address the quality side of value in value-based care. Prompting processes are essential ways to resolve problems. These can drive alerts to staff who can take appropriate action and reduce alert fatigue from EHRs, which have a tendency to alert indiscriminately. Learning how and when to prompt can be aided through techniques such as machine learning and even clickstream analysis applied to EHRs. That is not just the web. Another use is integrating data from multiple sources into clinical decision making, which improves the ability to develop smart prompts. EHR data must be supplemented with data from medical devices, vital signs monitors, patient diaries, outcomes data, and patient experience of care data, just to name a few examples. But normalizing data is essential to make valid comparisons and provide insights into such as cost variances, out-mitigating revenue at service line level, performance of health system relative to competition, and physician performance. Yet another example is enabling staff to build revised rules to address, for example, new regulations, sudden outbreaks of diseases, triage patients in catastrophic events. The examples presented here, as noted, are just a few of the seemingly endless examples possible with analytics. These examples should also reinforce the fact that analytics is important for all aspects of value-based care, not just looking at cost from the perspective of the health plan contracting or quality as measured by regulated metrics. In fact, I've just read about concerns for CVS taking over urgent care and the potential impact that could have on hospitals' ability to sustain themselves. For while value-based care is intended to improve health and lower healthcare costs, the fact remains that the true emergency care, intensive care, and other uses of hospital inpatient settings will still be needed. So yet another use for analytics is how to deliver such services in a changing landscape. The list of examples of analytics uses in value-based care should also suggest that there are many types of people engaged in making analytics meaningful. Typically, hospitals employ health information management and information technology professionals who are responsible, respectively, for data quality and data information governance, and implementing and managing the IT infrastructure and supporting use of the many and varied applications used in the information infrastructure. Increasingly, informatics professionals, health, medical, nursing, and so forth, are being deployed by hospitals as well. Informatics professionals primarily help design systems to collect, analyze, and use data and information at the point of care. While they are certainly employed by vendors to aid in the actual development of software in the healthcare delivery environment, they aid in implementation of these systems, especially configuring them to meet specific user and use case needs. They can address the integrity of data analysis and help optimize use of technology by end users. Analytics professionals are sometimes distinguished from informatics professionals as those who design systems to model, predict, and improve the intelligence of the organization. Analytics professionals are not necessarily clinicians or even health professionals, but have a solid understanding of data and its processing to produce intelligence. Increasingly, informatics and analytics professionals are becoming one and the same. Data science is yet another discipline that plays a role in analytics. It is considered to be the interdisciplinary process to unify statistics, data analysis, and related methods to understand and analyze actual phenomena. Where health information management and health IT professionals might be considered two sides of the same coin that are focused on data and information, informatics, analytics professionals, and data scientists might be considered two sides of another coin that has a laser focus on knowledge and intelligence generation. Large healthcare delivery systems and health plans are very likely to employ all of these types of individuals or may complement their own staff with vendors who supply these services. Smaller facilities, physician practices, and small health plans may not have the resources to hire such staff, but attempt to find a single individual who can fill several of these roles with help from vendor services. Some vendor services are very focused on providers, others on health plans, and a few are servicing both types of entities. Increasingly, EHR vendors are taking on some of these roles with respect to analytics, especially for small providers or for large providers who engage them to coordinate with both their own staff and vendors.